Hello to you after the summer break. The channel has reached 10,000 subscriptions. You watch a lot, you give me a lot of comments, a lot of positive feedback. So thank you very much for all of that. I was even in TV.
Xin chào, tôi tên là Kay, tôi là một nhà vật lý trị liệu và hôm nay tôi sẽ chỉ cho các bạn các bài tập cho bệnh liệt mắt.
So I think the time has come for the first Q&A episode today about Bells Palsy. I will answer your questions. But if you're interested in a specific problem, you can jump straight to it because all the questions are written in the video description. Let's start. Why should we wait for 2 weeks before we start the exercises? I was told the sooner the better. The reason why I recommend starting exercise after about 2 weeks is physiology. For the first days after Bell's palsy, the nerve is usually completely paralyzed, which means it is impossible to make almost any movement with the affected side of the face. If at this point you try to force movement by exercising in front of the mirror, your brain will systematically send information to muscles that will not respond and will not give positive feedback. It is completely different when nerve conduction begins to return, which usually happens after about 2 weeks. Then you only support the movement of the muscle to which the impulses are already reaching, which gives the appropriate feedback to the brain. In addition, the muscles of our face usually work symmetrically. If you force a movement too much, with one side completely paralyzed, the other unaffected side will be more stimulated. This leads to a very dangerous pathological distribution of muscle tension. In my experience, patients who start rapid, intensive rehabilitation through exercise from the first day after paralysis more often develop synkinesis. That is why personally I recommend to start exercises when you see at least the slightest active movement of a given muscle. It's usually around second week. Okay, next, what about if years have passed and you still have symptoms? Can you use these exercises? Yes, of course you can exercise. However, the effect of exercise is less noticeable the more months or years have passed since the paralysis. Importantly, in many patients, there remains a slight asymmetry that never disappears. And you must be aware of that. It's not a big one, a few percent, but still. But there's also something very interesting. Patients who have suffered from Bell's palsy focus very much on achieving perfect symmetry, which they usually didn't have before the palsy without even knowing it. I've encountered a situation several times when after 3-4 months of therapy, the patient regained muscle function. It seems to me that he's okay, but he takes a photo and he tells me, look, Kate, the corner of my mouth is still lower. This is not a full recovery. So then I say, okay, bring photos from a year to 3 years ago. And we look together and wow, the corner of his mouth was already lower. It was like that throughout the patient's whole life. He just didn't pay attention to it. We are asymmetrical by nature. For example, I will now show you my photo and tell me whether I had Bell's palsy or any other facial paralysis or not. If we draw the line of the mouth, eyes, wrinkles, nothing matches. Even the way we smile and speak is asymmetric. And no, I have never had Bell's palsy. It's just that my face is naturally asymmetrical. So to answer this question again, yes, you can exercise, but it probably won't help you much. If many years have passed and there is still a significant difference between the condition before the paralysis and your current condition, then you would need to consider more invasive solutions related to plastic surgery or facial muscle surgery. But there is also a question, aren't you demanding perfection that was not there before? Third question, how long should you hold like your smile when you hold it up? There is no clear answer here, but not that long. A second is enough to give feedback back to the brain. So I would say a few seconds is absolutely enough. Let's remember that our face is used to express emotions, and it is from our face that other people can read what mood we are currently in. All these movements that I showed you in my video with exercises are movements performed by us unconsciously in certain circumstances. We frown when we are angry, we smile when we are happy, etc. So in fact, it would be ideal if these exercises were combined with the appropriate background in our head. When you practice smiling, think about something pleasant. When you frown, think about something that annoys you, and so on. Then the time you are asking about will be the most natural for you. I just got Bell's palsy yesterday. Do I have to go to the neurologist or just doing this exercise is fine? No, you need to go to the doctor first to be properly diagnosed. The diagnosis of idiopathic Bell's palsy is made after excluding many diseases that may also cause facial nerve palsy. In other words, there are many diseases that can cause facial nerve paralysis and are treated in specific ways, so your doctor must examine you. What should be excluded? Lyme disease, Ramsay-Hunt syndrome, tuberculosis, HIV, trauma, sarcoidosis, vasculitis, neoplasm. Really, it is important because there is a reported 10.8% misdiagnosis rate from specialty referral centers. So 100% you should go to your doctor first. Do not diagnose yourself and do not treat yourself at home. If your doctor diagnoses Bell's palsy and recommends exercises, only then should you use them. I am very sad because facial paralysis. This is an aspect that is rarely discussed, but I believe it is very important. Our face is us. It is our expression. It's our beauty. It's the way we think about ourselves. We look in the mirror every day, and when facial paralysis occurs, a huge tragedy occurs for every patient. For every patient, without exception. Many patients completely withdraw from everyday life, become depressed, and even avoid contact with friends and family. And of course, I have no psychological education, and I will not discuss here the issues that go on in the patient's head. But I want to draw attention to one extremely important thing. Better effects of therapy are achieved by people who do not withdraw from everyday activities for long. And of course, for the first week or two at most, patients usually go on medical leave, but after that, early return to other people is conducive to proper treatment. And there is also a medical justification for this, as contact with other people forces emotional reactions that involve the muscles of our face. So by returning to social interactions, you are somehow forcing your muscles to return to contraction activity, and even better, you are doing it unconsciously. So I recommend to all my patients to leave the house, not to be afraid or ashamed, to talk to others, to smile, and just to live normally. Do you suggest the exercise to be done on both sides? Other videos suggest the other side to be stretched, massaged. No, I don't recommend to exercise non-paralyzed side, because the non-paralyzed side exercises itself during individual movements, so there is no point in providing it with additional support. On the non-paralyzed side, we have no problem with the flow of nerve impulses, so there is no point in repriming it. Therefore, we perform movements symmetrically, and with our fingers we support only the movement that is missing on the paralyzed side. As for the massage, I do not teach patients self-massage because firstly, there is no evidence of their potential effectiveness, and besides, I have never seen any spectacular effects of massages for Bell's palsy. Next question. 4 years ago, when I was 13 years old, I was in a car crash, and since then right side of face doesn't move and I rarely did exercises. I wanted to know if it is possible to recover now after 4 years. There were many similar questions where you mentioned the traumatic origin of facial paralysis. And here the question is really not for me, it's for the neurosurgeon. What exactly is damaged there? If there is a permanent, complete interruption of the continuity of the nerve, then the answer is no. You can't practice it, you can't cure it by exercises because there is no physical way for the neuroimpulses to flow. But if you are dealing with the compression on the nerve or only partial disruption of nerve fibers, there is a chance for movement, but it all depends on the specific case. So I can't really answer such questions. You simply need to consult your specific case with a facial neurosurgeon. How long does it take to recover from Bell's palsy? What treatment methods are effective? It's worth saying that evidence-based medicine is lacking when it comes to treatment and outcomes for Bell's palsy. The problem is made more difficult because many cases resolve spontaneously. Regarding the first question, usually it takes 3 to 6 months to recover, but some people will be fully functional within 2 months, others may need several months or even years. And as I mentioned earlier, a small group of patients will remain in a small deficit for the rest of their lives. As for the treatment, Bell's palsy resolves completely without treatment in 71% of cases. It's really a lot. Treatment with corticosteroids has been found to increase the likelihood of improved nerve recovery. Regarding physiotherapy, recommendations are limited due to the quality of studies in the current literature. Tailored facial exercise programs and mirror therapy have shown the most promising results in early rehabilitation efforts. Nonetheless, further research is needed to establish standardized treatment and rehabilitation protocols. And that's what the science says, and it probably won't say more because it will be very difficult to conduct any reliable scientific research on this issue. This is due to the fact that Bell's palsy is a diagnosis of exclusion. There is quite a high 10% rate of misdiagnosis. What is more, it would be very difficult to create proper study and control groups because we can't give treatment to some people and leave other patients without treatment. Summing up, I wouldn't expect any breakthrough discoveries here in coming years. It's also worth adding that therapeutic procedures vary depending on the country. In some countries, Bell's palsy is not treated at all. In some countries, steroids are administered. In some, steroids and rehabilitation is recommended, etc. So to briefly summarize, the treatment of Bell's palsy lasts approximately 3 to 6 months, and the most frequently recommended form of therapy, at least in Europe, is corticosteroid therapy combined with physiotherapeutic exercises. That's it. I hope it was interesting. I wish everyone who is currently struggling with Bell's palsy a full recovery. And please remember, treatment is a process. So follow the recommendations of your doctors, of your physiotherapists. Take the meds, do the exercises, and be patient. Thank you for watching, and see you next time.